The exercise I'll be discussing right now is a row, whether that's standing or in the prone position. This is part of the strengthening rehab phase. It's sort of similar to resistance training, targeting the upper back, deltoids, and biceps. The exercise prescription may be 2 to 3 sets to 10 to 15 reps per side, or just cumulatively, depending on what kind you're doing, whether it's single arm, as seen in one of the videos, prone, and just double arm in the other. A progression would include increasing weight, speed, or increased sets of reps. You can slow down the movement, especially in the eccentric lowering phase, to increase time under tension. In terms of regression, you can decrease weight, and depending on what position is done in that moment, you can also change the position. Um, and so they can shift from standing to seated or prone rows where they have more stability. They can also have assistance, whether it's like using machines that provide consistent resistance and stability throughout the movement. Um, they can also limit the range of motion to what's comfortable and pain-free, especially if it's like recovery from an injury. And you can also decrease sets and reps. So you would want to discontinue use when pain is greater than a 3 out of 10, or if numbness and tingling occurs, the patient cannot complete the exercise, or if they're moving on to a different rehab phase. Um, you would want to progress them when exercise can be successfully performed with current weight, sets, and reps, and no discomfort or pain is occurring during that movement, and that their form is correct as well. So, as you can see on the top right hand, there's a standing row. So, in order to do this, you would want to stand facing the resistance bands or cable machine that's anchored at about mid chest level. You would grasp it with your hands and pull them towards your torso while keeping your back straight and your elbows close to your body. Um, you'll squeeze your shoulder blades together at the end of the movement, and then you'll return to the starting position with control. And then for the prone row, which you'll see right next to it, you want to lie face down, whether it's on a table or a bench or wherever you are, with your chest hanging slightly off the edge, as you can see. And you want to hold the dumbbell in one hand. If your table's small enough for you to do two hands, like an incline bench, you can do that. You want to pull the weights up towards your hips, keeping your elbow close to your body. Squeeze your shoulder blades together at the top once again, and then lower the weights slowly back to the starting position. Yep, that is it. Thank you.